Dr. Sudev Mindarana is the residency director and an emergency physician in Chattanooga, Tennessee. He is instrumental in arranging the educational opportunities at the American College of Emergency Physicians annual conference.
ACEP16 is the pinnacle conference for emergency physicians in the United States. It allows us to come together to exchange ideas and information, network, and learn about all the newest research and how it impacts our patient care. We also get together and are able to understand each other's practice patterns, learn from each other, network, and also create an opportunity for change at the national level with our advocacy efforts.
One of the elements that has played a major role in the past few years has been the InnovatED, a space in the exhibition hall that features new tools and technology that will make up the future of emergency medicine.
InnovatED is the showcase for new technology. It's like a crystal ball into the future, but the future is now. These are products that are cutting edge, that are unique, and are making changes in patient care. From ideas to share information better within the emergency department to new technologies that allow us to care for sicker patients in a more efficient fashion. We're bringing battlefield technology to the ED, information technology to the ED, and also cutting-edge thinkers in Incubate ED, allowing them to emerge, share their ideas, and get some traction with even some venture capitalists. Emergency medicine on the front lines is an ever-changing field. Most of the products in InnovatED have been released within the past 12 months. Some of the products were actually not even on the market yet. So the changes that occur with our emergency physicians and the technology, it occurs at a daily basis. It's important for people to come out and to come to a meeting like ACEP16 so we can learn about these new technologies and also apply them to our patients.
In InnovatED, you see emergency and trauma bays with simulators, actors, and dummies designed to immerse the participants in the new technology and see what it looks like in their environment.
And we're taking ultra-high fidelity simulators and using them in an integrative fashion so a physician can see how new products, new ideas, and new technologies can impact patient care in their usual daily workflow. We take pre-hospital patients all the way to the operating room. Using these simulators, a physician can understand how the technology translates into their daily practice. It's important to be prepared and to train and to understand that we can see as emergency physicians anything at any time. This allows us the opportunity to practice medicine and rehearse in a safe environment that's controlled for situations that we don't see on a day-to-day basis. Mass casualty incidents, critically ill pediatric patients, bomb explosions, earthquakes, mass casualty shootings. These are types of things that we can rehearse here in the trauma bay at InnovatED. We can use these simulators to practice on high fidelity models. We can use these simulators to prepare for critically ill patients in the emergency department, so we're all on the same team. We can also use these simulators in a multidisciplinary format where we engage our nursing staff, respiratory therapists, and even hospital administrators to help improve the delivery of patient care. The realism of a high-fidelity simulator allows us as physicians to get as many senses involved with the simulation. We're able to have the same fear, anxiety, and procedural skills that we do in a real patient with a simulated patient. This allows us to replicate as best we can the real patient scenario, allowing us to train in a fashion that we're going to practice.
One area that will play a key role in future access, especially to rural populations, is telemedicine. Dr. Mindarana sees this as the future of access to the highest quality care possible.
Telemedicine allows for instantaneous information exchange and consultation among providers with a minimal investment. Telemedicine allows a patient from a rural area to talk with a subspecialist in a very large tertiary medical center. Telemedicine connects providers together and improves patient care through technology. Using integrative products, we're able to implement telemedicine in a variety of applications. Here you can see that telemedicine is linked to emergency department flow, patient throughput, and increases quality of care at a reduced cost. Telemedicine currently is not implemented throughout the country. Telemedicine is important for rare conditions or for specialty evaluations currently, but it's evolving. Patients are carrying smartphone applications. They're allowing them to connect to a healthcare provider just over the phone. Telemedicine will continue to grow as patients demand instant interaction with a healthcare provider. Now, we do lose a little bit of the physical touch with telemedicine, but we're able to deliver high quality care instantaneously. All patients can benefit from telemedicine, from the baby boomers all the way down to the millennials. What we're seeing though is an explosion of utilization of healthcare online resources by millennials, both healthcare and education of healthcare professionals, but also millennials accessing healthcare from their smartphone or from their computer, providing patients with high quality medical consultations and peace of mind without having to leave their community.
In the end, the meeting and InnovatED are about better care, bringing the most advanced technologies, techniques, education, and tools to emergency patients.
Some of the patient changes that you may see are improved patient tracking systems. That allows patients to be seen quicker, to reduce errors in the emergency department, and also improve emergency department flow. A patient might also benefit from some of the new technologies, point-of-care ultrasound, ultra-rapid CT scanning, and pre-hospital technologies for hemorrhage control and safer, more comfortable transport.